Hi, everyone. I just wanted to welcome you to the webinar this afternoon. I'm going to give just a couple of minutes for people that are signing on in the last few minutes here, and then we'll get started. Okay, so I think we're good to go. So I want to start by introducing myself. My name is Marie Rowland. I'm a billing specialist here with Therap. I work mostly in New York, New Jersey, Maine, and Texas. So if you don't know me yet, then welcome. If you do, I'm so glad that you've joined us. So today we are talking about, this is kind of a general look at setting up billing in Therap. We're going to look at how service authorizations are set and how service descriptions are linked along with funding sources and creating a process that will help you create and submit claims in a simple, seamless fashion. So if you haven't seen yet already, everybody that's joined the meeting is on mute. If you have questions as I go along through this process, definitely just type your questions into the question box here on the webinar. I have my billing friend here, Bonnie, with me, who's going to be answering questions as I go, and I'm going to try to grab them, as I see them, and then we can certainly go over them at the end. So with that being said, we are going to jump right in here. So I am going to share my screen with you. Okay. So here we are on the Therap dashboard. So what I'm going to start with down here, we're on the admin tab. So I'm just going to go down to the bottom here to this billing section. So if you haven't heard this from me or from someone else already, what I really refer to this section is of the admin tab. This section is really the foundation of your billing setup. This is where everything starts, and it's how it's going to function from there when you get to the actual billing tab. So the first thing that I think we should look at here is the funding source information. So what I have in here, the funding sources, it's the driving force of your claims. This is telling Therap where, when you create the claims, where they're going to be submitted, if they're going to be submitted, and how. So in these that I have looking at here, so here's one of the options that I have. The name of this funding source, it's Molina Medicaid runs it. In this case, I'm looking at New Jersey's account. So this is our electronic billing connection to New Jersey Medicaid. This is the payer. So anytime this is selected when you're setting up service authorizations and claims, we have our electronic trading partner agreement set with New Jersey Medicaid. So your claims are created, sent to New Jersey Medicaid directly. I know we have people here, present that are from all over the country, from different states that have different processes. So I know some of this, to some of my friends that I saw from New York, some of the things are going to be a little bit different. I have people that I saw from South Carolina. So this is going to be a very generic overview. If you have state-specific questions about submissions, anything like that, again, just type them into the box, and we'll certainly answer those to the best of our abilities. Along the lines of this funding source here, if you are in a state that you're functioning with MCOs, you'll have different payer options listed in here as to where and which MCO claim information is going to get sent to. There are also times where you're submitting claims to a private insurance company, let's say. That is also an option for an electronic payer. Those we set up again on a provider specific, state specific basis. So we have the ability to send to insurance companies as well, as long as they accept electronic claims. Those will go through a clearinghouse, and that's stuff that we can go through, one-on-one with providers and talk through and see what your options are if they do arise. The other option that you have is you have the ability to use a manual payer. So if you had things that you're looking to track that maybe are funded, services funded by grants, services that are private pay, if something needs to be generated as an invoice, maybe to like a school district, something along those lines, If you still want to be able to document for those folks, that are within your programs the same way as everyone else, yet they're funded differently, this is a really good way to be able to do that. So I have, the name of whatever that source may be. You're going to put it up in here, but then rather than having that electronic submission, you just have a manual bill. So even if you hit send accidentally, it's not going to get accidentally sent to Medicaid, which is a big plus. And you can also run reports based on this funding source itself. So if you're looking to, collect and generate that information based on which vendor you're using, this is a great way to track that. So that being said, the next piece that's going to go along with it is your agency specific information. So again, down here at the bottom. So I have this billing provider information here. So this is where you're going to house the information that you're using on the claims themselves that will show you, you'll have your billing provider, your pay to your rendering provider. In some cases, maybe some therapies might apply to this. You'll have referring providers that you can use. If you have a private physical therapist and they're using their own NPI number, you're going to list that on here so everything can be laid out on the claim correctly. So this billing provider information lets you list that out. You have, like I said before, if you're just putting in your agency specific information, you have this non-person, you're billing for your organization. If you have somebody that's privately licensed, such as a therapist, a psychiatrist, something along those lines, you have the ability to pick this as a person rather than an organization, and you'll use the identification information down here as it is appropriate. So you have the fields to put in, the federal tax ID number. You also have the social security number if the state Medicaid system requires that for somebody that's licensed privately. You have the Medicaid provider ID. This sometimes can be known as a vendor ID depending on what state you're in. You have this NPI number. Some claims, some of the professional claims will require you to use a taxonomy code. So that taxonomy code is going to filter in based on which NPI number you're using to bill here. And then you have the rest of your provider address information. So once you have all of these billing providers listed that you are going to use on the claims, I'm going to go back out here. So that's the first couple of steps is foundational that we have here. So the next thing I want to talk about in this billing foundation here is the description code list. So these are all of the rate codes that you're using to bill. So this, when you first sign on with Therap and we begin your setup process, this module in this field itself, this is completely blank. You're only going to fill in which rate codes your agency specifically is using to bill. So this is going to look a little bit different to everybody, but I'll show you what kind of goes into this. So if I open up a day have service here, so up at the top, you are saying the description of the service provided. The service code is either going to look something like this, and again, this could look different in New York. It's a 4-digit numerical value. This code is kind of it's used broadly across the country, but for day services, this might look a little bit different for everybody. You're also telling Therap how you want to measure your units. In this case, I want to measure my day have units in 15-minute increments. You could call this quarter hour, whatever, however you prefer to see it. And then the rate for each one of those quarter hours. If the services that you're providing require modifiers that kind of point us in the direction of, needs level, things along those lines, we have the modifier field here that you're going to use to distinguish that. You also have this automatic unit calculation at the bottom. So this you're going to use based on your state's regulations. You have, again, the unit of measure. I'm saying the service is being measured in 15-minute units. You also have this rounding algorithm here. So this can vary from place to place. In the account that I'm looking at right now in New Jersey, we're using the half up rounding algorithm because as long as you have 8 minutes of service in a 15-minute time span, you're allowed to collect that unit. So I have it rounding half up. So it'll collect a unit anytime there's 8. Anytime there's less than that 8 minutes, it's going to round it off. So you're not collecting units where you shouldn't be. There are some places where if you don't have a full 15 minutes, you can't collect any money whatsoever. So we have this completely down. There's really an algorithm for any scenario that we can think of at this point. So you're also saying what the smallest increment allowed is. So in this case, again, it's 15 minutes. That might be a variable change as well. The other thing to look at, if you're not billing in quarter hour units, you might be billing as a daily rate. So if I look at, this would be a residential service. So again, I've described the service above here as it's listed. I have the service code with the appropriate modifier for this level of need. This time I'm measuring this as a daily unit rather than a quarter hour unit. So here's my daily rate for this service specifically. Down here at the bottom, you can see I don't have a rounding algorithm set because it's a daily rate. We're not using time to collect our billable units, so this does not apply in this case. I'm going to go back to the dashboard again. So the last thing to consider when we're looking at this piece of the billing setup is how you want to take this information and generate your billable units. So we've told Therap already by setting up those service description codes that for that service, we know how to measure it. If either it's based on time or it's a per diem daily rate. From there, you have the option to say, I want my staff to document their time in and out directly on the ISP data forms that they're documenting their tasks. Or you have the option to use attendance for some of these timed services. So if you want everything to be in a nice, pretty, visually pleasing grid, we have the attendance module where you can enter those times as well. When you're setting that up, it's going to look a little like this. So if I look at Dayhab here, so again, here is the type of service that I'm documenting for. I am using the time in and out here is set to yes because I want to base my units generated off of the time in and out documented in attendance. And this duration in this case is set for the entire day. That use duration option, so if you had somebody that came into Dayhab in the morning, maybe had a doctor's appointment midday, but then returned in the afternoon, what that duration is doing is saying that it's going to apply that rounding algorithm that we set up in the service description to the total duration of minutes for the day, rather than to each session being the morning and the afternoon. So you're going to get the appropriate amount of units for this service specifically. There are some services that for each session would generally apply to, but Dayhab, more times than not, is the option that we're going with here. So we have advanced settings in the attendance module as well. The one that I have selected here is to use the ISP data as a supporting document. This is one of my favorite safety nets that we have built into Therap. So anytime that you're using attendance to collect your billing data, you have this set to make sure anytime you mark somebody as present with a time in and out, present is our billable option, as you can see down here. Anytime that that's used in attendance, attendance will know to look for ISP data documented within that program as you have it set here to validate the fact that you're billing for a day. So if documentation is missing, the attendance module is going to give you a very clear warning of a red box. And if you haven't heard of red boxes yet, you certainly will soon, trust me. So those red boxes are saying something is wrong, we're not going to generate billing until a correction's made, and you have everything here to support it that you've told us you want to use as support. Down here in this attendance option, the other nice thing about using attendance for services such as day services, community supports, things along those lines, is you're able to collect a lot of information here. So yes, of course, we have present our billable option. Here I'm saying that I only need one piece of ISP data to support a billable day. That you can modify if your agency or your state requires you to have more than one piece of ISP data in the day to support what you're billing for. You can certainly modify that as needed. But you also have a slew of spots that you can put non-billable attendance options in. So if you, as an agency, want to keep track of how many times your site is closed due to weather, if somebody's sick, if somebody just does not call and not show up, anything along those lines, whatever type of information your agency is looking to collect, you can certainly put that in here as a non-billable option as well to utilize to keep as a running track of information. It's not going to give you billable units, but it's nice for census purposes and other things here. So I am going to go back out to the dashboard. That's really, that's a broad view of what that foundational billing piece setup contains. Sometimes there's going to be more information that's going to go into this process, but those are some of the core fundamental pieces that you're going to encounter. In the billing tab itself here, so now that I have that complete, this would be the part where you're telling Therap how you want this billing information to come through based on each individual. So if I look at a service authorization, I'm going to make a brand new service authorization for somebody within my DayHab program. So these service authorizations are first program-based and then individual-based. So if I pick the person that I'm looking to create a service authorization for, so I have Laura here in our DayHab program. This individual ID type is automatically defaulted to the person's Medicaid number. This individual ID type is, again, it's telling when you go to generate a claim, Therap needs to know what identification piece is going to go onto the claim itself. So you can see that little note underneath it. This is the ID that's going to be sent to a payer. So for many waiver services, a majority of waiver services, you're going to use that individual's Medicaid number. If we start thinking about, billing to an insurance company, to an MCO, to a CCO, anything along those lines, there are circumstances where they're not looking for the individual's Medicaid number necessarily, but rather their insurance ID number. Or Medicare would be another scenario where that would come into play. So this is pointing for Laura or DayHab, which ID type do we need to use to get onto those claims. You have other options here. These two aren't filled out initially. We have the ability to use these for some other features as far as accounting goes and that kind of stuff. That stuff we would talk about, again, on a provider to your billing specialist basis. The next core piece here is that funding source. So you saw the list of funding sources that we set up initially. So this, again, we're saying, for Laura for DayHab, where is her billing information claims going to go to? So in this case, for Medicaid, I'm going to pick Molina Medicaid as my option. If I had somebody that I'm looking to create an invoice for, perhaps, then I could pick one of my private pay options to say this is how it's going to be set. Here you're going to put the begin and end date in. And again, these dates are going to vary based on where you deliver services. If you get a prior authorization for service, you're going to use the begin and end date off of the authorization details that you receive. Otherwise, if there aren't, if there isn't a prior authorization and service is just continued as needed, the begin date in this case is really going to be what day do you want to start collecting your billing data information? And then your end date, again, either is going to be off of that authorization that you receive, or it's just going to be when that service is going to end. So I need to put dates in here just so I can go further. So I have a 6-month authorization. So the next thing here, you have service coordinator, this section to use in a handful of different ways. If you have case management information that you need, support coordination, Medicaid service coordinators, whatever the case may be, you have the option to use this. This is not a requirement, however, so I'm going to breeze right over that. And I'm going to add a service here. So for Laura, I'm saying that she is approved to receive DayHab services. This is going to filter in from the service description that you input initially. So it's automatically going to fill out that it's a 15-minute unit. It's going to fill out that default unit rate. And then it's also going to give me the modifiers that I'd put in there before as well. So here I'm going to say how many units this person is approved for. So this could be the number of units off of their authorization. This could be a number that your agency has set, for forecasting and fiscal reasons. It all kind of depends on, again, where you are, where you're delivering services there. So I'm just going to go ahead and put a number in here for maybe 2,500 units. This patient responsibility amount is not used on a regular basis. This you would use if you have somebody that is responsible for a portion of their actual, service delivery. So you can use this. There are some ICF services where this is going to come into play. This I would want to talk about on a more, specific level as to how you use this and when it's appropriate. The modifiers are in. So here we have the ICD-10. Again, this, if you're getting an authorization letter, that primary diagnosis code is going to be listed on there as the diagnosis that you're using for the services. You have the prior authorization number field. So if you have the prior authorization number, this is where the claim is going to read it from. If you're not using this for anything, it stays blank. Here is the data collection information. So this is where you're saying, I want to collect my billing data one of these ways, depending on where you are. So billing data input allows you to create your billing data form IDs manually, which in some cases that might be the appropriate way to go, other cases not so much. You have attendance and ISP data, which is what I'd referred to before. You can either collect your billable units using the attendance module or directly from that ISP data, time in and out that's documented. You also have the ability to use case notes. Case notes is a super cool module that if anybody wants to talk about further, I'm happy to do so, but I could spend a long time talking about it, so I'm not going to go down that path right now. Here you have the option to add a supporting document. So again, if you think of a residential service, maybe as a good example, and an individual has maybe 4 ISP programs within their residence, only one of those ISP programs has actual billable tasks on it, but the 3 others maybe contain something like doing laundry, doing chores, something that's not considered billable and used towards their valued outcome. So you don't want to use just any ISP program to say, yes, this is billable. Maybe just one of those I want to use. So I can link this directly here if need be. This automatic unit calculation, again, filters in from what you set up in the service description. This authorized units per period is a pretty versatile thing to use on the service authorization. So you can, the main thing I love using this for is the monthly utilization report. If you set this period to monthly and you say on a monthly basis, I expect this person to utilize 400 units of DayHab, the utilization report in Therap, when you generate billing data, you can pull that utilization report at any time during the month, and the utilization report will tell you how much of the way and what the percentage is towards the utilization that you're expecting to get. So if it's, we're in the 8th of January right now, if I were to run that utilization report, I should be about 15% towards my utilization, somewhere along those lines, depending on how many days you're in program and whatnot. So that, I absolutely love using that for this purpose. There's also scenarios where in some parts of the country, you're restricted to how much you can actually generate in a day for a service. So if I think of day services here in this case, I know that for DayHab, I'm only allowed to provide 6 hours of DayHab each day. So what I could do is say that on a daily basis, I only want to generate 24 units because it's a quarter-hour service. From there, we can use this validation. For the monthly, when I'm just setting an expectation of how many units to collect, I have it set to ignore. I don't want any restrictions to occur. I just want calculations to happen. For this daily example, we have a handful of different options here that you can use to create the billing data. So if I tried to document for 7 hours in a day, you have restrict, and what that will do is take that time in and out that you've done, either in attendance or ISP data or case notes, whatever the case may be. It's going to generate only 24 units of billable data. It will not exceed that amount, so you're not claiming information where you shouldn't be. The next one is one that I lean towards a lot of times, is this restrict and continue. So again, if I had 7 hours of billable time, it's going to give me my 24 billable units, which will be submitted on the claim, but the billing data form ID will show that I have 4 non-billable units. That, I think, is nice, because if this is something that happens on a regular basis, we have billing data reports that you can pull that'll say, okay, so for this person or this program or this service, however you run it, you have this many non-billable units that you've generated in whatever time span you've run it for. So it's a good piece of information to show, hey, we're providing services, not necessarily being paid for them. What do we need to do differently? Do we need to increase staffing? Do we need to decrease service hours? Whatever the case may be. So that's kind of nice.
Hey, Marie, we have a couple of questions.
Shall I address those, Bonnie?
You want to wait till the end? Yeah, one of them for sure, and the other one we can wait till the end. If you put the authorized units per period as monthly, will you see the total units for the quarter report?
If you put the authorized units per period as monthly, will you still see the total units for the quarter in the report? I think I need to know. So Lauren, the total units for the quarter. So maybe, are you saying that you're running the report for a date range for the quarter rather than running it for 1 month? Okay, so perfect. So you will still see that, you'll see the total units that you've billed for that quarter. The only difference with running that utilization report as a date range is you're not going to see that percentage, that monthly utilization percentage there. But yes, you'll still get the total units billed on that report run by date range. Is that what you were asking? Did I get that? Okay, perfect.
Thanks. Yep. Sorry, thank you.
No, thank you, Bonnie. Let me know if anything else comes up that we should take care of while we're talking about it. Okay, so the last piece here, this block option is just a complete block. If you go over what you set as your daily, monthly, weekly, whatever the case may be, if you set it to a certain number and you go over it, it's not going to generate anything. So that's a pretty severe block right there. It's an option for sure, but that definitely limits what you're going to do. So if I'm going to save this here, so now I have my service for this individual, for this program listed. If this person is in a program and receives more than one service during the day, so if she were to be approved for transportation, maybe I would add the service right here as well. If there's any community-based services, behavior support services, anything along those lines, as long as it's occurring within that program, you can attach that service directly to this service authorization. If that service is offered elsewhere outside of the program that I've selected here, you would just want to make sure you're making another service authorization for that program specifically. The next thing down here, so you have the notification level. This is nice for a lot of reasons, really. So this notify before expiry. So if this is a 6-month authorization, I kind of want to know when this is coming due to expire so I can prepare myself for the next round that's coming up. So here I can tell Therap, you need to notify me 15, 30, 45, 60, or 90 days before the end date that I've listed here. You can also do with the total unit percentage left. So if I've set this to 2,500 units like I had above, I want to know when there is 5, 10, 15, 25, or 50% of those units left. You can set that up to either notify you by SCOM, if that's a module that you utilize as an agency. You can also have it send you an email, which will give you, the authorization ID. No HIPAA information is released in those emails. It's just an authorization ID that you can use to find that. I do see, so Terry, who does this notification go to? I'll show you that in just a second, but that is totally a user preference. So if you wanted to receive this information, I'll show you how you'd set that up. If anyone else that would benefit from receiving those, they would set that up in their own user preferences. If you want to be notified for some but not all, would you only set in the authorizations you want? Exactly right. So if there was somebody else in this program maybe that isn't waiver approved and I don't want to receive that, that notification for it, I would leave these completely blank. I would just set this for those that I want to be notified of. So you have this attachment section as well. This is a handy little function that you can use. So if you're getting these authorization letters, anything that's going to directly correspond with this service authorization, you can attach it if it's already on your desktop and you've loaded it. You can also scan it and attach it as well. So this is nice just to keep everything in one place. I really like that. And again, you have a comment section. Do what you will. So this service authorization is good to go. You have these 3 options. You can save this, you can submit this, you can approve this. This is agency preference as well. It depends on the procedures that you have set in place of who's creating these authorizations. Do you want the person that's creating the authorizations to approve it so you can start, generating your billing data immediately? Or do you want somebody to submit this and have maybe a supervisor, manager, or something along those lines come in and approve it once they've submitted and completed it? Totally your choice. I have it approved. I'm good to go. To Terry's question, I want to show you how that notification information is set up. So I am going to go over here to the settings tab. So here, you can see on mine right off the bat that I have these 3 options. I have notification information, I have notification profile, and I have default notification profile. If you don't see these 3 options when you click on settings, you need to enable this function. This is in an odd spot. So what you would do up here in the personal details, you're going to click edit. And you are going to scroll down to where you see time zone. Underneath time zone, you need to have this checkbox selected that says enable notifications. If that isn't there, you're not going to see those 3 options that I just looked at on the dashboard. Once that is there, the first thing you want to do is configure that notification information. So here I have my email address. This is where I want to receive those authorization notices by email. You also have the ability, if you put in, that the text, whatever the text string is, if you want to receive that information by text rather than by email, you can put that in here as well. Once you have that set, the next thing is your notification profile configuration. So here, you can see the drop down for the module name. Keep in mind, this notification profile you can use for so many different things in Therap. So depending on what your role is, you can use this for a number of different things that happen in Therap. I'm going to focus on the task at hand, however, and I'm going to select service authorization. So now for service authorization, here are the 2 optional events. So yes, I want to be notified when a service authorization is due to expire. So if I've set those expiry days, I'm going to get the notification for that. This low unit notification, if I set that percentage number, I want to receive notification for that. And here's the media type that you want to receive it by. You could do all three, you can do just one, totally up to you. So if I want to receive it by email, I would hit yes. If I'd filled out that text field, I'd hit yes here. I'm just going to put SCOM because that's what I most commonly use in Therap, and save. So now you can see it's been updated. I am good to go. So like I said, anybody that wishes to receive those service authorization notifications would go through that process and enable that in their own account. Okay, so past service authorizations. Oh, okay. In New York, we can build authorized units at either a group or one-to-one rate. So is there a way to have two service codes share authorized units? Now that is a fabulous question, Mark. So in New York's case, being that they do those funny things like for community-based pre-voke, they have 3 different rate codes for the same exact service. At this current point in time, because I think I know exactly what you're saying. So let me give a visual to that. So if you have all 3 of those community-based pre-voke services listed here, right now, all that you can do is set the limit for each one of those rate codes individually. So I know for a service like that, where you are restricted to 24 units in a day, that function of restriction doesn't really help because you could technically collect all 3 of those rate codes in one day. However, I know that we are in discussions of, the possibility of having that apply to a service authorization rather than to a rate code. I have nothing definitive on that to say when it's going to occur, how it's going to function, but it is certainly in our radar because that is such a big deal to not only New Yorkers, but there are other scenarios across the country as well. Did that answer your question, Mark? Okay, good. So from the service authorizations, the next thing we have is the claim information. So once you go through attendance, through billing data, ISP data, case notes, and you have those billable units collected, the next piece of the equation is to create the actual claims. So you have a couple of different ways of doing that. You can either just do a brand new professional claim, from scratch. So you could pick the payer that you're looking to submit claims to. You would pick your billing provider, pay to rendering provider, service facility referring provider if necessary. And then you would pick the date range and the service description code that you're looking to generate for. You have the ability to do that each and every time that you generate claims if this is the most simple and straightforward way to do it for you. If you're in a state like New York where you're generating only institutional claims and not professional, you don't have this option. In that scenario, you have claim templates. So institutional claims require claim templates for generation. Professional claims, it's optional. What's nice is that once you set this, you set it and you're done with it. So what I'm doing here with the service authorizations, that was done on a program-based basis. This is individual, billing provider, and payer specific. So this takes it to a whole different level of data generation. So what I would do here is select my person that I'm looking to create this template for. I'm going to pick the billing and provider information that I'm looking to use. So if I'm thinking of Dayhab, I want to use my billing NPI number, and I want that to apply to the billing, pay to, and rendering provider. If this needs to change for some other reason, if the pay to provider or rendering provider needs to change, you can certainly edit that. If your claims require a referring provider, you can certainly add that in addition here. If you're in a state like Pennsylvania, Maine, and there's other areas too that require a service facility location to be on the claims themselves, you can set that on here as well. The next thing you're going to set is this place of service. So for Dayhab, I'm going to say that I always want that to be set to 99 for other unlisted. If I was doing this in a residential facility, I could certainly pick group home or whatever applies to the scenario in question. So this service link section is all of the services that Laura has approved service authorizations in the system for. So if all of these services are going to be billed underneath this billing provider information, you can certainly select those. If the only thing she's receiving is DayHab, I'll do a little of this. So these services, let's say, are going to fall underneath a different billing provider. So if I submit this one and I go to do another one for Laura, maybe pick a different NPI number here. So now you can see down at the bottom, now those are already connected to another claim template. They're no longer accessible to be connected to this one. So there isn't the risk of having to, having two claim templates with the same services, have them overlap, overgenerate, that kind of thing. Does it have to have an individual name for the claim template? Yes, if you don't pick an individual name up here, no information is going to appear beneath it, because once you pick that individual name field here, it's going to look to the service authorization section to see what services that person's approved to receive to populate this information down here. Is that what you were looking for, Lauren? Perfect. Perfect, perfect. So once you have all of your services assigned, I'll just assign the rest of these here. So now I have my claim template set for Laura. The last piece of the puzzle is the actual claim submission itself. So there's two different ways in Therap that you have the option to submit your claims. You have the professional or institutional claim submission send here. You also have this claim submission send claim. Both of these options are available for both professional claims and institutional claims, whatever the case may be. So the difference between these two options, there's a couple of things. The most prominent difference would be is this professional claim send allows you to send batches of claims in a small batch manner. This claim submission send claims is a large batch claim submission. So it has a couple of different functionalities. It can just go out the door, two different doors to the same thing, basically. I just want to grab this one question before I start going into that. So I usually do claims per service, so it does multiple individuals. I believe that is easier than doing the template that you're showing, right? It can kind of go one of two ways. So yes, it can be easier to do it that way. If I do claim generation using templates, it would look like this. So I'm going to do new using template rather than just new. And you can still generate it based on rate code. So that is not going to be too much terribly different from what you're doing now. So I can still generate all of my DayHab tiers, all of the DayHab all at once for the service dates that I'm looking to generate for. And it's still, I don't think there's anything in here right now. So it's still going to bring up the list of my individuals that I have with approved service authorizations with claim templates for that service for that date span. So it kind of has the same functionality. Came in late. Is this presentation specific to New York or is what you're demoing relevant to anyone doing claims? This is relevant to anyone doing claims. This is not New York specific. You must have jumped on when I was answering a New York question. Sorry. So maybe that's something, if you wanted to talk about that at some point, Lauren, to see what your options are, maybe using templates might make your life easier. Maybe it wouldn't, but I'm happy to talk about that with you anytime you'd like. So once you have claims generated, so I'm going back to the submission of claims. So there's a couple of different things here. This professional claim send, again, is the small batch claim submission, but you have some cool options here. So in either scenario, you have to pick the payer where you're sending your claims to. So if I'm just picking Medicaid in this case, I can pick the service dates to capture anybody within that date range that I want to submit claims for. I can narrow it down based on service description, based on funding source, based on, whatever, however I want to narrow it down. I can make this a broad selection based on dates, or if I want to trim it down, I can do that. The cool thing with the small batch claim submission is on the next screen, when I hit search, it's going to bring up a list of individuals that you're about to send out the door. So you can see the list of people that you're going to send prior to hitting that send claim button. The flip side to that is it's only going to let you do between 50 and 100 claims at a time. So if you are sending out hundreds upon thousands of claims, whatever the case may be, this would take a lot longer than using the other option of the large batch claim submission. The other nice thing that I say that this does that the large batch does not do is it lets you go across service months. So if you were trying to do something from the last 2 days of December into the first week of January, you can cross the service months here, but still, it's only a small batch submission. With the large batch submission, so these service dates have to be set within the service month. So you can only do it within a service month at a time. You're still picking the payer, just as you had in the other submission option. This time you have to do it by service code as well. You can't select more than one service code at a time. In a state like this that uses a tiering system like this, all of these DayHab tiers are service code T2021. So I can pick all of these all at once. I just couldn't pick, say, individual supports as well. As long as the service description itself is the same, you can select it. If it's not, you're sending them out one by one. You can narrow this down as well by individual name or billing provider and the service date from and to. You can also, so if somebody had an issue, let's say you sent claims out, they were denied because they weren't eligible or because DDD made, an error in their authorization or something, so many scenarios I could think of. If you have not made an error on the claims themselves and they just need to be sent back up, then you can click on the send denied claims and they go back out the door as is without you having to go into each of the claims. You can also narrow this down based on where you created the claims, like during that date span, and you would hit send, and out they go. So this, when you hit send in the large batch claim submission, it's not going to let you pick and choose what claims you send out like in the small batch, but you're still going to get that same list of information that says, here are all of the claims that you have submitted. So it's going to tell you, you'll get your happy green check marks if everything has met your standards, or you'll get those little red X's as well. So that is billing in a nutshell. I know I have gone through most of the questions here, except I see one here from Christine. I lost Christine's. I'm getting there. Okay, so what happens when it says nothing to display when you do the search? Christine, are you talking in the send? Like when you do claim send? No, when searching for the claims to send. So if there is nothing there when you are searching the claims to be sent, either there might be, let's say, another search parameter set that maybe you didn't want there. So in this, in the send section, maybe the create date that's automatically defaulted every time I click it open. If you're trying to send claims that were created prior to this date, then it's going to tell you that there is nothing there to send. So that's one of the things. You can delete that out and try to hit search again and see if that resolves the issue. If not, it would be a matter of searching for the claims themselves and make sure they're truly there, that they were generated, that they aren't just billing data forms at that point. Or you could check to see if they're in billable status. So if it's a claim that had been paid prior and you hadn't changed it to billable status, something along those lines, it's not going to show up as available to be sent at that point. Does that answer your question, or was there more to it than that? Okay, so That being said, oh, do you have any tips when entering funding sources for private pay or grants? Do you still need service authorizations and claim templates if they are not prior authorized? So that kind of depends. If you are looking to collect information for private pay or grants, if you want to be able to collect and track billable units, if if that's something that needs to get reported back to an agency that's paying you a grant, or if you're submitting an invoice for private pay, you would still need a service authorization, because the service authorization is telling Therap how to collect those billable units for you. If you want an invoice, you would want to use the claim template or just generate a claim, because the invoice itself is attached to a claim form. If you're not looking to print an invoice of any sort, the claims might not be necessary, but it kind of depends on the situation. And I'll see Christine's email. And yes, the recording of this webinar will be posted to our website in the next few coming days or week or so. So yes, certainly it will be able to be viewed again if somebody couldn't make it, or if you wanted to review the information. Okay. Thanks, Bonnie. You can search for it under webinars. Good call. I should have said that out loud, huh? Thanks, Bonnie. So that being said, if you have specific information that you wanted to address with myself, with Bonnie, with your billing specialist for your region, certainly reach out to us anytime directly through email. You can also submit questions, concerns, things like that through the feedback section of Therap. And you also have live help if you choose to utilize that as well. So please, I thank you all for taking the time to join us today. Very much appreciated. And we will see you soon. Thank you, everyone. Have a nice day.